Okay, good morning. It's a pleasure to be here today. I will briefly introduce the benefits of the morphocompositional analysis of kidney stones. As you know, renal lithiasis is a complex multifactorial pathology defined by the formation of stones in the kidneys. The formation of renal stones requires the presence of more than one abnormal factor. In this process, the importance of each factor depends on the nature and intensity of the other factors involved. Therefore, having a detailed understanding of these factors is key for addressing the prevention, diagnosis, and treatment of this pathology. Despite remarkable advances in the urological management of kidney stones, a significant increase in the prevalence of renal lithiasis has been detected worldwide. The exclusive removal of the stone without conducting an adequate study of the underlying causes that lead to its formation only addresses the symptom of a disease that will often result in recurrent episodes. Recent studies continue to confirm that renal lithiasis has a very high recurrence, with percentages exceeding the 50% after 10 years. The global rise in urolithiasis is due to multiple factors, as it has said this morning, such as aging population and increasing rates of obesity and diabetes, resulting in higher healthcare costs. Another reason contributing to the high prevalence could be the wide range of kidney stone types. This can be classified as follows. These are up to 5 types in which calcium oxalate is the predominant component, representing over 70% of the total. The phosphate stones make up around 20% and can precipitate in 4 different species. Another major group, as you know, is formed by uric acid stone, which represents more than 10% of the total. Each of these types is associated with a combination of characteristics and etiological factors that explain their formation. Different clinical guidelines on urolithiasis consider stone analysis an elemental and the starting point in the study of the disease. In particular, the clinical guidelines on urolithiasis by the European Association of Urology specifies that all patients should have at least one stone analyzed. Also yesterday, Dr. Elawaris, during his presentation at the Congress, stated that knowing the type of kidney stones is critical for recommending an appropriate diet. However, the reality is quite different. In general, the percentages of stones subjected to this type of analysis is quite low. And in these cases, chemical methods are the most used, despite not being the most optimal approach. However, morphocompositional analysis provides fundamental information about the causes of stone formations, the conditions of nucleation and growth. For instance, a papillary stone here at the bottom, where we can identify the renal union, the papillary renal union, sorry. Also, we can find the recent or past activities of lithiasis. We can see sequential analysis of the stone from the nucleus to the periphery, who allows to reconstruct the history of the lithiasis. For instance, at the top, this is a mixed uric acid in the nucleus and calcium oxalate monohydrate in the external layer. The components found help us identify the possible causes behind their formation. Therefore, the morphocompositional study of urinary stones is essential for selecting complementary diagnostic tests and guiding the initial treatment for a patient with kidney stones. The results of metabolic analysis are sometimes inconsistent with the results of the morphocompositional studies, leading some researchers to question the importance of these morphocompositional studies. However, this inconsistency adds more value to the results of the morphocompositional studies, as they provide important information about the cause of stone formation. We can compare, it's like a movie where the lead actor is the stone itself, and revealing its origin and evolution over the time. Also this morning, Dr. Ramos explained that in some cases there are an abnormal value or any abnormal value in the parameters of the patients, and however they have a kidney stone. Also, Dr. Maines, in a database that he has with more than 600 patients, he found that around 30% of the patients, they don't have any altered parameter. It has been suggested that it could be due to the urine collection was not done properly. However, we think that it's due to the metabolic studies conducted at the time of stone expulsion do not necessarily reflect the urinary conditions during its formation. Instead, they represent more of a snapshot of the current situation, which often has little connections with the conditions that cause stone formation. However, as previously mentioned, the percentage of stone subjected to morphocompositional analysis is generally quite low, and in these cases, chemical methods have been the most common use. Although there are many commercial kits and they are easy to use and affordable, they do not provide complete chemical or structural information. The results can be ambiguous and are incorrect in up to 50% of cases when examining single component samples, with error rates reaching up to 90% in stones with more than one component, which are in fact the most common. As Dr. Isern said this morning, it represents in a sample of more than 40,000 patients the 73% of the total, so it's 3/4 parts. In addition, chemical method has consistently shown low reliability in many quality control programs. For these reasons, experts in the field recommend that they should be abandoned for the classification of renal stones. Regarding the infrared spectroscopy, although it can be used for very small sample, it has many limitations. It's usually a destructive technique. Also, it doesn't provide information about the internal structure of the stone or minor components. It means less than 5% of the stone. Additionally, it has an error rate of over 10% when analyzing stones with multiple components, which are the most common. Also, in these cases, when the samples are heterogeneous, infrared should be performed on each specific area, and normally it's never done. In summary, infrared spectroscopy provides useful general therapeutic recommendations, but on its own, it doesn't offer enough detailed information about the kidney stone and its etiology. Many authors suggest that the analysis of renal stone requires the combination of several techniques to establish the relevant information. The recommended procedure for routine kidney stones should include the stereoscopic microscopy, the scanning electron microscopy, and energy dispersive spectroscopy, and when needed, infrared. Additionally, in each case, it should be included a detailed report with specific clinical and therapeutic recommendations for the stone. For this reason, it will be ideal to use detailed kidney stone analysis to provide an accurate diagnosis and offering tools to help you, urologists, in choosing the best patient's treatment. This analysis is provided by my group, the Renal Lithiasis Research Laboratory at the University of the Balearic Islands, led by Dr. Félix Grases. The laboratory has been conducting this analysis for over 20 years and has already analyzed more than 15,000 kidney stones in Spain. Most researchers agree that the first step in stone analysis should be the examination using stereoscopic microscopy. This equipment, which requires no sample preparation or extraction. In practice, the analyst must first examine the external surface on the intact stone to determine its external shape, morphology, color, and dimensions, and more important, the evidence of contact with the renal papilla, like in this example here. This is the contact with the renal papilla. Also, we can see the present or surface deposits, for instance, in this case, with calcium oxalate dihydrate. Second step, we have to examine the internal structure of the stone to determine its composition, degree of internal organization, location and size of the stone nucleus, and also the position sequence of the different components. In some cases, this technique, the stereoscopic microscopy, may provide an experience analysis with all the necessary information about the stone. However, in other cases, it's necessary to use additional techniques such as the scanning electron microscopy with energy dispersive spectroscopy. From our point of view, it's the best option as it provides a detailed elemental analysis and crystalline structure. Also, the infrared spectroscopy, but it cannot identify compounds representing less than 5% of the analyzed portion. The scanning electron microscopy requires no sample preparation or extraction, offering magnification of up to 20,000 times. This technique can also reveal the stone's initial development area, providing key insights into its origin. A substance present in minimal amounts and detectable by infrared spectroscopy may be crucial for determining the stone etiology. For instance, one specific case involves a stone primarily composed of hydroxyapatite with minor components of calcium oxalate monohydrate and struvite, whose, as Dr. Isern said, indicates a urinary infection. To the very small presence of struvite, neither the microscopic, stereoscopic, or the infrared spectroscopy were able to detect it. However, using this SEM, the scanning electron microscopy, with energy dispersive spectroscopy, we could identify crystals of struvite, and we could analyze with the X diffraction, X rate dispersive, and identify the magnesium presence in this renal stone. Thus, the EDS, the energy dispersive spectroscopy, when coupled with the scanning electron microscopy, provides accurate information on elemental compositions, offering detailed insights into its microstructure and minor components. Like this, at the top, for instance, it's a mixed calculus from uric acid and calcium oxalate monohydrate. So, this combination can yield highly relevant information, making it an essential tool for studying kidney stones and fully justifying its routine use in clinical practice. If a stone presents a very unusual composition or is drug-induced, as described yesterday by Dr. Ramos during her presentation, the analysis will be completed using Fourier transform infrared spectroscopy. Finally, as a must, as part of the deliverables for this analysis, two reports are prepared. One for the doctor, which includes all the details observed, detected in both the morphological and the compositional analysis, as well as a series of diagnostic, therapeutics, and dietary recommendations that provide tools to help urologists in choosing the best patient's treatment. Also, images through the techniques are also included in the report. Additionally, we generate a report for the patients with more general information and minor details. These reports are prepared by specialized personnel with solid training and extensive experience in the study of these kidney stones. To conclude, we could say that the presented morphocompositional analysis helped the urologist with the necessary information in choosing the best patient treatment. In addition, it provides highly accurate information about the kidney stone, showing significant technical and clinical superiority over the other options currently performed, which primarily only indicate the predominant component without providing any other, like this, any other detail. It's all. Thank you for your attention, and I open to questions.
Thank you.